Hello, I'm Dr. Sylvia Regala, and welcome to an integrative approach to type 2 diabetes. Let's talk about the long-term complications of diabetes. Remember, diabetes is a total body inflammatory process. The primary area of the body affected most by diabetic complications are the eyes, kidneys, nerves, and endothelial lining of blood vessels. So if you have inflammation of the blood vessels in the eyes, it will cause a diabetic retinopathy. With the kidneys, you can develop diabetic nephropathy and have kidney failure. Those persons who have type 2 diabetes many times have peripheral neuropathy, where they have numbness and tingling in their hands and feet. And if you have endothelial lining inflammation, that creates hypertension, as well as accelerated atherosclerosis. These four areas do not require insulin to absorb glucose into their cells, as do the liver, muscle, and fat cells. When glucose is elevated in diabetes, unregulated glucose floods these cells and causes increased glycation and buildup of sorbitol. So let's talk a little bit about this. Poor glucose control results in retinopathy of up to 76% of patients with type 2 diabetes will form some type of retinopathy. Up to 56% of patients with type 2 diabetes will develop nephropathy, and 60% a neuropathy. So it's best to keep hemoglobin A1C at 7% or less. There are long-term complications of diabetes, and mostly this is secondary to glycosylation of proteins. What does this really mean? You have a non-enzymatic bond of glucose to proteins. And once you have this non-enzymatic binding of glucose to proteins, you actually have a change in structure and function of the protein. So once a protein has a glucose that's bonded to it, you change the structure and function, and this leads to deactivation of enzymes. It inhibits regulatory molecule binding, forms abnormal protein structure. And when glucose binds to LDL, it blocks its binding to liver receptors that signal cessation of cholesterol synthesis. So antioxidants such as vitamin C and E, flavonoids, which are found in brightly colored fruits and vegetables, alpha lipoic acid, all help reduce glycosylation. So when you have the bonding of glucose to a protein, you develop advanced glycation end products, or AGEs. So here you have a protein, and these are glucose molecules that bind to the protein molecule, and you end up with advanced glycosylated end products. And these are inflammatory, and these are what causes many of the long-term effects of type 2 diabetes. Here's a diagram of how elevated blood sugar increases sorbitol formation. We know that in the eyes, kidneys, nerves, and endothelial cells, no insulin is required to absorb glucose. So glucose just flows into the cell, increasing an intracellular concentration of glucose, and hence increasing sorbitol concentration. In a sense, this elevated sorbitol concentration is a toxin, is a pollutant. And the mantra of the body is the solution to pollution is dilution. So you have this incredibly high concentration of sorbitol intracellularly. So you have an influx of water intracellularly to try to decrease the concentration. In doing so, you destroy some of the cell membrane. As a result, you get a leaky cell membrane. You get a loss of the protective intracellular components, and you get death of a cell. And hence, you then develop diabetic problems with your eyes, such as diabetic retinopathy, diabetic nephropathy, a peripheral neuropathy, or inflammation or destruction of healthy endothelial cell function of blood vessels. Long-term complications of diabetes are basically caused by oxidative stress. More than half of all diabetics have hypertension. There is a single layer of endothelial cells that line blood vessels and act as an interface between blood components and blood vessels that regulate blood flow, coagulation, and formation of compounds that control blood pressure. These endothelial cells are damaged by oxidized LDL and free radicals, and hence can cause hypertension. When you have insulin resistance and hyperinsulinemia, you produce a decreased endothelial nitric oxide synthase. You also increase nitric oxide degradation, and you increase endothelin-1 release, and all of these have an effect on endothelial lining and blood vessels. These all lead to decreased nitric oxide bioavailability. Remember, nitric oxide helps expand arteries and decreases blood pressure. With a decrease in nitric oxide, you have an upregulation of vascular cell adhesion molecules and intracellular adhesion molecules in the endothelium. So this allows macrophages to get in between the endothelial cells of the blood vessel, which increases vascular permeability. Once the macrophage gets underneath the endothelial lining, it produces inflammatory cytokines such as tumor necrosis factor alpha, interleukin-1 beta, and interleukin-6, and all of this causes vasoconstriction and hence high blood pressure. These inflammatory cytokines then also increase reactive oxidative species and creates platelet aggregation. So now you have vasoconstriction, and you also have platelet aggregation inside the blood vessel wall, which then promotes atherosclerosis formation. There are long-term complications of diabetes, such as poor wound healing and foot ulcers, which are very common. You actually have microvascular damage, which impairs circulation in diabetics. Oxidative stress reduces vitamin C. Remember that vitamin C is an antioxidant, so if you increase oxidative stress, you're using up all of your vitamin C to put out the fire from inflammation of oxidative stress. And vitamin C is needed to make proline, and proline is needed to make connective tissue. So you need connective tissue to help heal ulcers, foot ulcers. Also, in diabetics, you have an immune dysfunction, which also allows for chronic foot infections. Your immune system isn't functioning well to fight off the infection of a foot ulcer. So here we have pro-collagen chains, and the pro-collagen chains make collagen. Proline is a part of the pro-collagen chain, and vitamin C is needed to make proline. Proline is needed to make collagen, and collagen is needed to make fibrils and connective tissue. So if you don't have enough vitamin C, you don't make proline, you don't make collagen, and you don't make connective tissue, and hence you can't heal ulcers. You have impaired diabetic wound healing from a multitude of things that are occurring in those persons who have type 2 diabetes. You have decreased immunity, so therefore your immune system can't fight off infection. You have hyperglycemia, which is really toxic to mitochondria. So if your mitochondria are not functioning properly, then the cells don't function properly. You have sensory loss because you have diabetic peripheral neuropathy. You may have numbness in your foot and may not even know that you have an ulcer. You have hypoxia because you have vasoconstriction. Remember, we talked about the endothelial lining being inflamed in vessels, and the decrease in nitric oxide. Nitric oxide is needed as a vasodilator. If you don't have enough nitric oxide, you get vasoconstriction. If you get vasoconstriction, you don't get enough oxygen to the ulcer. Also, vasoconstriction causes ischemia, meaning you don't have enough blood getting into the foot ulcer to heal. You have a neuropathy from diabetic peripheral neuropathy, so you may have numbness in your foot. So you may not know you have the beginning of an ulcer. You have an increased infection because you have a decreased immune response in type 2 diabetes. You have micro and macrovascular disease, as we talked about, the endothelial dysfunction in type 2 diabetes, oxidative stress causing inflammation, and a decrease in circulation secondary to the ischemia and hypoxia. So you have impaired diabetic wound healing, which is multifactorial. You have increased oxidative stress, which is a major factor in the complication of diabetes. In reactive oxidative species that are formed, these reactive oxidative species bind to and destroy membranes. Reactive oxidative species increase inflammation by increasing inflammatory mediators such as nuclear factor kappa B, C-reactive protein interleukin-6, and tumor necrosis factor. High intake of antioxidants counteracts free radicals and pro-oxidants. Hello, I'm Dr. Sylvia Regala, and welcome to an integrative approach to type 2 diabetes.